Okay, I'll start with reading this. Chapter 107 of the Acts of 2022, known as an act relative to extending certain state of emergency accommodations, was passed by the General Court and signed into law by Acting Governor Karen Polito on July 16th, 2022. That legislative action revised Section 20 of Chapter 20 of the Acts of 2021, and in so doing provided modifications to Massachusetts open meeting law, which allow for flexibility to hold remote-only and hybrid meetings while preserving public access and, where appropriate, public participation. Currently, that additional flexibility will expire on March 31, 2023, unless additional legislative action occurs. As part of today's remote-only meeting, all votes will occur. Oh, it's not remote-only today, but as part of today's meeting, all votes will occur via roll call. Okay. So I saw that there were several rounds of minutes that needed.
There are several rounds of minutes. There's the December minutes, there's the January minutes, and the February minutes.
Okay.
The changes that were requested last meeting for the January and December minutes, I believe, have been made, or have been made. Hopefully, they're correct with everyone.
All right. So any additional comments or edits to December, January, or February's minutes?
So an editorial, I think there's an NA where there should be an MA for Massachusetts in December.
Okay.
And then in February, Muzzy is misspelled.
Okay.
It's M-U-Z-I. Yeah, it's not M-U-Z-Z-E-Y.
I also caught one where it said Medford instead of Medfield. Carol had mentioned that to me. And there was one where Carol was talking about her volunteer work and it said work.
Madam Chair, I don't know when the right time to do this is, but before we approve the February minutes, which had a discussion of some of our concerns with alcohol compliance, it might be worth reflecting a little bit upon what happened at the hearing on Tuesday that Kathleen and I presented to the board. Only because I think the minutes that we are putting together are detailed enough that they actually kind of give away our strategy when we're trying to actually help the town promote better health and safety. To the point that the reception of the select board may be influenced by our minutes.
Can you clarify that a little more?
So I don't know if we should get into that discussion now or not. But we can.
So the board has discretion to approve its minutes. The minutes are supposed to reflect the discussion. How detailed they have to be, they don't have to be word for word. They're not a transcript. They're supposed to be a general summary. So do you have specific things in the February minutes that you want to make a little more general?
Yes, I think that probably be, it's not that they aren't accurate, they are. But let me just pull that section.
Could be a little more high level or something.
Exactly.
Page are we on here?
Yeah, I'm trying to look for the page where we are. That.
24.
Safety, bingo. Okay, so page 9.
Oh, no.
Yeah, we presented the letter that all of you saw, and only 2 of the select board commented, but Marianne Cooley's reception I thought was cool, to say the least. And throwing in the minutes that hey, we should make them pay for the compliance checks, and we want to take over from chapter 11 because chapter 111 because they're not doing a good job. The letter was, I thought, very well crafted, as something that would be reasonable to the select board. But if they see that an underlying agenda might be this, that kind of puts a poison pill in any proposal that we're going to put forward.
Okay.
And it's counterproductive to our work in protecting the health and safety of the town.
So maybe something like Dr. Epstein stated that if they, that we may need to discuss further if.
It doesn't even need to be that. It could be as simple as, there was discussion regarding the select board's, alcohol regulations. Several members thought that, the select board has not adequately, done X, Y, Z. There was talk about what the Board of Health might do in terms of improving compliance within the town. I mean, it can be that general. I mean, that gets to the gist of the discussion without being so specific to kind of indicate that, here are some of the actual strategies and tactics that we're talking about. I mean, I don't know how people feel about that. As I said, I have no issue with the accuracy of this. But I do think that it kind of harms our ability to actually function well with the other boards when we're already telegraphing, strategies and tactics.
Sure, okay.
I mean, just my view is there's a YouTube, that people can watch, right, of our meeting? Yes. So I don't see.
Yeah, so there is a transcript available for
Yeah.
people who want to do that, but my guess is the select board probably doesn't do that, but they may very well, and others very well may read the minutes and they read this without the context, and it can send a message that is counterproductive.
On the other hand, I could see where you might take out in the second paragraph on page 9, everything after where it says, take this over under chapter 111, but leave that in there as just sort of shot over the back.
Okay, well, certainly if the board wants, I could revise these and we could look at them the next time. And just sort of still have a general summary of the discussion, but make it a little bit briefer and a little bit more high level.
Sounds good.
That would just be my suggestion. Particularly because we are coming out for a town vote, in under a month on this very issue.
Yep.
Okay, any other comments? Okay, so I guess we'll have a motion to approve. Do we need to do them separately? Can we do December and January together?
Sure, and I guess just maybe the motion could reflect the minor.
Minor
revisions. We
edits,
talked about the Muzzy, the Medfield. Volunteered instead of work, Massachusetts instead of NA.
So I'll make a motion that we approve the December and January minutes with the minor editorial corrections. As indicated.
I'll second.
All in favor? Aye.
Aye.
And then we'll hold off on February till the
Yeah,
next
so
meeting.
we'll, at the next meeting, we will look at a revised February, and we'll also look at the minutes from our alcohol discussion on the 13th and from this.
Great. All right, let's move on to staff reports. We're getting the first one. Hold on. I need a paper copy of this agenda. Thank you. Yes, Michael.
Hi, good morning, everyone. So February was a pretty light month for emergency management. We did get the invitation sent out to all the players for the active shooter tabletop exercise at Babson College. That'll take place at the end of May. We have requests for quotes out for contractors to write the emergency sheltering plan, as well as to facilitate a functional exercise of the town's emergency operations center. Those quotes are due back today. And then our biggest item from February was the extreme cold response the first weekend of the month. The town response went fairly well. We lucked out that we didn't have any widespread long duration power outages in the town. We had 3 individuals that needed sheltering, and the town was able to provide them alternative shelters than opening an emergency shelter. So I think overall, the town's response was good for that. Any questions for me?
Can I ask on the when you do the active shooter drill, I'm assuming you shut down the campus,
So
you're
this
not gonna
is,
scare people.
so this is just going to be a tabletop exercise. So
Oh.
it's just going to be around the table discussing what plans and procedures are. But our hope is that this tabletop will lay the groundwork for future functional and full-scale exercises with the college and with the town of Wellesley.
When with the pipes bursting in 7 buildings, mainly schools, is there any, and I do not know the answer to this, but any sort of proactive assessment of, ones that are likely to burst. I could have some proactive maintenance to try to prevent this, because it's lucky that it didn't really impact.
So I don't know how much they can do in terms of proactive maintenance, but the town does have a boiler watch program. Staff from building maintenance will go around, rotate through all the town buildings overnight when they suspect that, pipes may freeze or something. And so some of the pipes that burst were, the sprinkler pipes, which are alarmed. But some of the pipes, that burst were not, and they're not alarmed. And so those were caught by the boiler watch program. So that was definitely highlighted as a strength of the town's operations.
You said it was mostly in the schools, right?
Yes, and one at the public safety building.
Okay. Was the new school on Central Ave? one of
Williams.
those?
I don't believe that was one of them.
Oh, okay. So that's the older building. so-
Remember, the public safety building is a brand new building.
That's
Yeah, that is.
When you say sprinkler, you mean fire or?
Yes.
Okay.
Okay, any other questions for Michael? All right, thank you. Next up is Talib.
Yep, he had family responsibilities, so just a very brief update, as you can see, working on the warming and cooling center plan, using our survey results to develop some trainings for our medical reserve for volunteers.
Questions on that? Okay, public health nursing, Hannah and Jenny.
Okay, so continuing with the blood pressure clinics. We're trying to advertise them more to get more people to come in a more consistent phase. But it is a little bit of a struggle to get people to come into that. The matter of balance classes, both of them that had started, they finished, the feedback was just really, really positive. We're having another class that is full starting on Tuesday and another one in a couple of weeks on Wednesdays. And people are just loving that. And then CPR classes, we're continuing those. Jeannie and I both attended quite a few trainings. And then the domestic abuse conversations by DBAC, we've done 2 of them. And again, we've gotten such great feedback on those that people really want to talk about that issue and want to know more. So we are trying to book more places to go.
Great.
And then there has been definitely an increase in people asking for help with the applications to self-help, which is good because I think we've been pushing this for the same people now for, I know my tenure here for 2.5 years. So some of them take many times of prompting to see if they would be willing to do that application. So I know this one says just 1, but I think we've talked about 2. I know I've talked at least to 7 people about it.
Have somebody coming in on Monday.
Yeah, so I'm hoping that it'll be something that people are more open to doing.
As far as one of the cases, the sum of 6 confirmed cases were affected. Julie was kind enough to update me that Maven state that antigen tests are classified as suspected. PCR culture tests are classified as confirmed. And so there's 6 confirmed and 1 suspected. We had 2 unrelated neurovirus cases that both ate ready keeping meals from 2 different grocery stores in the town. We did have 1 case for tested in a teenager who I tried to get in contact with through multiple outlets, including texts, a letter sent home with his mom, through his pediatrician, and no luck there. So it was kind of a dead end. I didn't hear anything from PH as far as if they had any luck with them. Yeah.
Yeah, that's kind of an issue, the pertussis one.
Yeah.
Because that's quite communicable.
Right.
So where does this go? I mean, that's someone where we really do need to, talk about, the isolation tracking and all of that. I mean, which
Right.
may or may not have been necessary in this case. We don't know. But we've got to be able to hunt these folks down when this sort of thing happens.
Right.
I mean, if you attend school, I take it in this town.
That's the thing, we don't know. Even the pediatrician's like, I don't know if he took a year, I don't know if he dropped out, like, that doesn't help me. Like,
Well, no, but are they attending school in Needham?
we don't know.
We don't know. I mean, but
Could
Probably
private
contact the school
school.
department, and find, I mean, they've got a roster. So, I mean, that might be one way, because if this kid's in school spreading this everywhere, that's an issue.
Yeah.
But that might be another means to try to track them down, again, depending on the age. I mean, I don't know if you said teenager, I don't know if this is 19. Yeah, so 18, maybe in the school system, maybe not in the school system. Yeah, I mean, sometimes in the emergency department, when we run into this, we actually have the police department do a drive-by home safety test check. So that's another way to get in contact with them when these sort of situations come up.
What was the timing of that test? Like, how long has it been now?
Tested beginning of February, but he started with symptoms at the end of January.
Yeah, these infectious for what, 6 weeks?
So we're
So-
just getting the,
Yeah, so I mean, there would be plenty of time to do that, but yeah, I would consider just asking the police to do a well-checked drive-by. Even if they just inform them, it's like, look, you're positive for this, Board of Health is trying to get in touch with you. Yeah, we can't force them to come in, but we can at least, notify them, and the police can report back, yeah, he's actually there.
okay, any other comments? All right, moving along to our COVID update, Julie.
I don't have a ton to say about the COVID update. But I'll quickly go through, a few of the things from the slides. Our 7-day average is very, very low, around 1 or so cases, 1 to 2. The 7-day average for Massachusetts has also been sort of decreasing and kind of plateauing. It's at 262 cases right now. Again, our vaccination rates haven't really been moving a ton, sort of slowly but surely, maybe every month and a half, we gain sort of a percentage of first or second booster doses. Seeing much more of an increase in the younger age populations continuing to get the boosters, but the older age populations have definitely sort of petered out. The hospitalization rates have decreased pretty dramatically since the beginning of the year, and continue to do so when you compare the previous reporting period to the current reporting period. The 7-day average for hospitalizations in Massachusetts right now is 424. And again, the percentage of hospitalizations primarily due to COVID has hovered around 25-ish to 30% of those total hospitalizations. I think sort of the big news on the COVID front that you probably have all heard is that this past week on Wednesday, the Healy administration announced that the COVID-19's public health emergency will end on May 11th, which is in alignment with the ending of the federal public health emergency. So there have been some, I don't know exactly how that will impact sort of data being updated. They haven't spoken on that yet, but I assume that there will be changes to that. They've already sort of removed some of the alerts from their website. I believe the town of Needham has also done that as well. So our COVID dashboard is still up, but they've removed sort of that alert at the top. But I will definitely keep track of sort of data collection changes for sure that this may impact.
One of the things, the state is going to shut down, coincidental with those dates, the Stop the Spread testing sites. It has enough at-home tests in its stockpile to last a while. The question is whether the dates, the expiration of some of those tests will continue to be extended. They've been extended a couple times. The state also has, the feds and the state have sufficient COVID vaccine to last into the early fall. But there is, at least right now, no plan for the federal government to subsidize COVID vaccines after, beyond what they've done so far and beyond the stockpile they've built up. It does prompt a question for us of, do we order COVID vaccines? Right now, there'll be single dose vials, so the concern about wasting will be diminished. But the cost is estimated around $125 a dose. We judiciously built up a very high balance in our immunization fund. So we can afford to spend some money, presuming town meeting allows us to increase our spending limit, because town meeting sets the spending cap. But we have money. I think the challenge is at $125 a dose, You know, if you order 1,000 and there's only interest for 500, that's a lot of money going to waste. So I think that's something we're gonna look at as a staff, but we'd also like the board's opinion on. One thing that is potentially an option for us is because our shared service agreement partners don't have particularly strong public health nursing functions or are building up their public health nursing functions, we could potentially buy a larger amount and do it across a 3 or 4 town region, so there'd be less likelihood of having an unused vaccine.
And is there any talk about pricing changes at all that you
A
heard?
lot to talk about it, but none that the state is probably going to try to, with its vaccine fund for children, include COVID in that. That obviously would be beneficial, but there's no guarantee that will happen or the funding will come through for that.
I'm just trying to think how to like link this to the influenza vaccine, because obviously we want people to get both. And my suspicion is people who are willing to get the influenza vaccine are also willing to get the COVID vaccine. By and large, there will be some exceptions to that. But does it make sense then to order COVID vaccine kind of, judging it based on our previous experience with influenza vaccine?
Probably. And we're pretty decent at anticipating, we don't have hundreds of unused doses. We usually get within 50 or 100. We order accurately within 50 or 100. So there's some options out there.
Plus, will there be a combined vaccine at some point?
They've said for this season, no.
Okay.
That's been, I mean, that could change, but as of now, there's no plan for a combined vaccine for this fall, maybe for next year.
Also, our policy has been, and I think it should continue to be, for someone who does not have insurance or is unwilling, largely because of concern about monitoring, to provide insurance, we've always still given them a shot if they want a shot. That is a good policy, I believe. It becomes a more expensive policy if we're talking about not getting reimbursed for COVID vaccine.
What percent of your shots are, yeah,
2%, 3%.
it's a good policy, I think.
I was also gonna talk about like whether we need to do this COVID update anymore. I mean, there is a dashboard that, I mean, it's mostly repeating. Vaccination numbers for our town are pretty useless. Most people, those shots were years ago. Really the only important information would maybe be boosters, right? So kind of a reset for the next season, whenever COVID truly has a season, but definitely peaks in the fall for sure. So I just think it's not necessarily worth the time to put the material together and others think. And with the emergency ending, it's sort of a good time to wind things down.
I mean, what would be useful is vaccinated versus unvaccinated. If there's a way to, kind of define that, if you will. Because COVID, I mean, clinically, we are still seeing patients who have not gotten any vaccination and still they're the ones getting hospitalized. So when we look at the hospitalization numbers, we're going to want to be able to break that down, if only behind the scenes.
Yeah, I can do that for the case. We can only sometimes tell if someone's been hospitalized or not. It's totally based on whether the information was put into Maven.
Sure.
But I can break down the cases based on vaccinated, unvaccinated, and sometimes hospitalized.
Yeah, but as Kathleen suggested, first dose versus second dose versus first
Yeah.
booster dose.
Yeah.
That's, I mean, it's not called a booster unless they've been vaccinated.
Right.
So we might be able to combine some.
Okay.
So we would continue to have the update at the March and April meetings, and the final one would be in May. Is that appropriate?
Well, and I think, it can be a line item type thing of, if there's something to report, I think, as a Board of Health, we should be having, like we do influenza or other things, we should be thinking about it, but it may not need to be quite as,
Sure.
Yeah, there's
Robust.
a change.
Yeah.
Sense.
Mm.
Okay. Would we, well, in terms of flu and COVID vaccine for the fall, we would do clinics like we did in the past, and would you do both at the same clinic, COVID and flu?
I mean, that's what we did last year.
Yeah.
We
okay.
did do that, and I think we have learned some ways to make it smoother, even smoother when we have two clinics. I mean, two vaccines at the same I don't see why we couldn't.
Mhm.
I know last year we did about what, 800 flu shots-ish?
Yep.
So,
Mhm.
Any other?
So one question, you said that, COVID vaccines won't be reimbursable, do you mean by Medicare and Medicaid?
So we will still be able to bill insurance. Currently, when we give a COVID vaccine, we bill for the cost of putting the needle in your arm.
Mhm.
We don't bill for the vaccine itself because we got it for free.
Right,
When we purchase, for example, when we purchase flu vaccine, we will bill your insurance for the cost of the vaccine and for the cost of administering the vaccine. So for when we start purchasing COVID vaccine, you'll start billing insurance for the cost of that.
and that
vaccine.
would be also Medicare and Medicaid,
Yeah, all major insurers,
okay.
Just not if they're uninsured or don't want to give their insurance.
yes.
Epidemiology.
Oh, right. Just sort of wanted to give brief updates on our community health assessment, which is, we're working through a pretty solid draft of, just generally the types of information that we're putting in there. And again, if there's something that you think would be really interesting to be included, you think would be really important for the town to know, certainly let us know, and we can see if we have the data for it. We're putting in data from the Census Bureau, a lot from the Metro West Adolescent Health Survey, the survey we did on healthy aging in Needham. We are identifying that there is a gap between the under 18s and the over 60, and we're missing a lot of that information. And we've definitely identified that as a department. So we're trying to find ways to pull in that data from the state. Some of it is sort of out of date, unfortunately. Trying to find ways that maybe we can pull in county data or something like that to fill in gaps where we may not have Needham specific data. Other update quickly on the COVID testing, sort of on that front. We were seeing sort of no interest in the COVID testing. We've started to advertise a little bit more, and I'm seeing a little bit more of an interest. We've started to advertise it out to Dover, Medfield, and Sherburne as well. So hopefully we'll get some more interest. We do have the tests and they're free. So we're trying to make sure we, advertise to people that that's a great resource.
The community health assessment, hospital has to do one every couple of years.
Yes.
So-
We've actually been pulling from the VI community health assessment as like our underlying structure. We kind of took it straight from them because they did a great job with theirs. So yeah.
Okay, thank you.
The only other thing, when we talk about youth substance use, we're talking about alcohol rights and stuff, and we think about adult use, misuse.
Yeah, that's a great area that we've identified sort of a gap in, that we have some youth substance use data. We have a little bit of sort of aging the opinions on substance use, but that middle population, we can pull some state data from, and a lot of that state data is very outdated, or the best we can get is like on a Massachusetts level. So in the community health assessment, we've definitely identified that as a place that we should be working on. Yeah.
Thank you. All right, shared services grants.
Diana?
Yep, I'm here. I can't turn on my camera, but you guys can't see me anyway, so I'll just be the disembodied voice like always. So for shared services, Roland and I went to the MHOA housing code training just to make the board aware that the Massachusetts housing code is being updated, and those updates take effect next month in April. So our staff has been trained on those updates. Roland has been doing a lot of inspection work for the town now that we don't have a full-time environmental health agent for the time being in Needham. While we're looking for that or finalizing getting that new agent, Roland has stepped up and has been helping out with a lot of the routine and follow-up inspections, especially food establishment inspections. In terms of shared services work, as you guys are aware, and I'm sure many of you participated in interviews with Regina Villa Associates. So those interviews were completed at the beginning of this month. And the working group that has formed, which consists of at least one, we've asked the chairs of the boards of health in each town to join, and at least one public health staff member from each town. We will be meeting in person on Monday. So I'm excited to see how that meeting will go. Again, the goal of the working group is for us to all meet together, discuss our capacity assessment, and we're kind of going to be discussing how we can help each other and where our gaps are and how we can fill those gaps to provide extended public health capacity throughout the whole region. The goal again is to create an intermunicipal agreement between all 4 municipalities, so that hopefully we can create a structure that makes sense for us. Because the Public Health Excellence Program, it's not a cookie cutter program. It's definitely something that is unique to each shared services arrangement. And hopefully we'll get to that point with our working group that we have our IMA set. So I will discuss in a little bit. I have a presentation on our capacity assessment results toolkit. So there's a copy of it in this Board of Health packet, and I have a short presentation on it. But we finally received the results from that 3-phase capacity assessment that the state had conducted. Just a quick reminder, the first phase was a workforce survey. Second phase, oh, now I'm forgetting the second phase, but the second phase, we had the third phase was a document request. Second phase was, first was a baseline capacity assessment. That was a lot of questions just on the requirements that each health department is supposed to be like providing based on the current Massachusetts law. Second phase was a workforce assessment where each individual public health staff member was asked to do a survey based on what work they do for their public health department. And then the final phase was a document request where various inspections report, including food establishment, housing, tobacco, camps, were asked to be collected. And now we received the toolkit, which has the data from all the municipalities. Right now, our capacity assessment only includes Medfield, Dover, and Needham. Sherburne joined later, so they did not have a chance to do their capacity assessment. But the data will show us just how we're doing as a region. It's not showing each individual town, but kind of put everybody together. A reminder that I want everyone to be aware of is that engagement with racial equity training is a requirement of the Public Health Excellence Grant. The Office of Local Regional Health is offering a training that's called Racial Equity 101, Building Foundational Knowledge and Skills to Advance Racial Equity. There is a link in my report, and I highly encourage everyone to participate. They have various times throughout March and April that they're conducting the training. It's a 3-hour training. I took it last Wednesday and I found it to be very interesting. But we do need members from each municipality to participate. So if you have time, I highly, highly, highly encourage you to sign up and take the course. Yeah, so those are my major updates. I don't know if anyone has questions, and I will dive more into that capacity assessment toolkit a little bit later in the meeting.
Diana, there aren't any April, that calendar only goes to March. I tried to click in and see when these are being held. So
I'll double
just
check
an
because I was
updated
told
link.
it was March and April that there was trainings.
Okay, it's on this calendar link only goes to March.
Okay.
Okay, let's move on to substance use prevention. Karen?
Thank you. Good morning. The month of February was spent largely on planning a lot of future initiatives. For example, our coalition is working on bringing a social host community education event to the community, largely the parent community, in May. So we've been lining up a speaker panel for that, and we're partnering with the administration at the high school as well as their PTC. So we're pretty excited to be working with them. In terms of our Stop Act grant, we are just about finishing up year 2. Our budget for that winds down at the end of April. We did submit our annual progress report to SAMHSA, and in meeting with our grant officer yesterday, she anticipates no issues with the information we've provided. So we expect our continuation award imminently for year 3. We are also looking at our upcoming schedule of compliance checks with the police department and TIPS training in May. And our SALSA students have been very robust in their advocacy work. They contributed 122 hours during the month of, do I have that correct? January, I have to correct that. And in terms of other planning, we are looking ahead to more strategically towards our alcohol compliance. We spent a fair amount of time, as you know, preparing some data, working with Julia on that for our February Board of Health meeting. So we look forward to future discussion on that as well. Thank you.
And then, Tim, do we have an update as well from about substance use prevention grant here?
Yep, so we have Carol and Lydia.
Okay.
I can start out.
That'd be great.
I can add some more. A big event that we had in February for our grant, we had our site visit, which is a requirement of the grant. They do hold it virtually, so we had representatives from BSAS who fund the grant, and we invited our strategic planning consultant. We invited members from each of the 4 towns, the health directors and other people that we work with in each town, and Tim, other folks from Needham. And we had a presentation to give them about our plans for moving forward with strategic planning, but we used a lot of time for asking questions and allowing the other members from the other communities to ask questions about the grants and plans moving forward. So I thought it was pretty productive. And since we've had the site visit, our next steps moving forward are to set up the strategic planning meetings. So that's what we're working on now. You can see in the packet, we listed strategic planning meetings in preparation with a DEI consultant that we work with, Nicole Augustine, and our consultant, Jessica, at Prevention Solutions. So we're kind of working on setting up those meetings and making content for them. I think we may have also mentioned in the past, Dr. Jernigan's alcohol health and safety report. I think Carol handed it out, but we've finalized plans for an event in April. We're holding a community forum in Needham Town Hall and online live, and Dr. Jernigan will be there. I printed out some of the flyers. Actually, do you mind if I hand you a few? Thank you. So we're looking forward to that and excited if anyone else wants to have a couple in April. We have a good lineup of speakers. I think Dr. Jernigan from BU, Dr. John Kelly, and Dr. Amy Turncliffe. So we're looking forward to that. And just a few other meetings we attended. I conducted a key community member interview for our grant. So we're kind of wrapping up with our data collection for this year for our grant, as well as we're moving towards the strategic planning meeting. Do you have anything to add, Carol?
Thank you, Lydia. I don't know why I can't see my own face, but that's okay. Thank you very much. I guess I'm not a face today. Thank you all so much. And I'm grateful to have Lydia. When Tiffany hired her, she introduced her as my partner. And I just have to say that she has taken this work to heart and has learned so much. And I'm grateful to have a young BU School of Public Health grad to work with, funded through BSAS, and she's contributed to our department. But I feel like what I'll say, and I listened to Stephen and Kathleen present to the Board of Selectmen. I feel grateful because what we've learned from this regional prevention funding is that we can collaborate across towns and make things happen and partner on evidence-informed and evidence-based strategies. So we are very focused on alcohol at this time, even though our grant says we can't work on strategies until our strategic plan is finalized. So with Alcohol Awareness Month in April and the poignant data that David Jernigan put together through his report, all of us in our region, funded with our grant, as well as in the public health partners I work with, understand we need to take a more proactive community education approach to alcohol access and the health harms. So that's why Tim is moderating this event on April 13th, and we hope you can all come. We're not looking to impact anyone's business model, but we do see through the failure of sales to minor rates that there's a lot of work to be done. And I appreciate this board advocating, as well as the boards of health and prevention teams from Dedham and Westwood and Walpole. So thank you.
Tim, thank you, Karen. Tim, do you know if our select board is aware of this event? And should we be encouraging them to attend?
We should be encouraging them to attend. I did send it to my boss and asked her to share it with the select board. I don't know if she has done that yet. I think they usually batch communication. So if I missed this week's, it will be next week's.
Could we, as the Board of Health, issue a separate special invitation?
Sure. Okay.
Be a good idea.
Yeah.
And then we should make sure some of us can attend.
I'll try and do
Oh,
that.
yeah.
I have to check, but
It's also gonna be 2 days after there's a vote on expanding licenses, right, in the state.
Mhm.
Yeah, so the more we do to publicize this now, it's actually perfect in
Yeah,
some
would be
ways,
great.
because you can't say that we scheduled this in order to, subvert the vote, but we could certainly publicize the issue.
Yeah.
Okay, great.
okay. Lost my
Thank
page.
you.
Hold on. Thank you. Where are we? Scrolling. Next is traveling meals, Rebecca.
Hi, so for the month of February, much status quo, we did 764 meals to 46 clients. Of those, 39 were Springwell clients, 7 were private pay consumers. No 911 calls, that was great news. We had 5 new clients, and 6 clients did cancel the program. One of the highlights of the month was the Friends Board. They included Valentine's Day chocolates for all the residents or other clients. They included a sugar-free option for our diabetic clients. So they just wanted to remind people that there are people out there that care about them enough to share, to send a Valentine's Day message for them. So that was a very nice thing for them to do. So do you have any questions?
Do we know why the 6 canceled?
2 of them went into assisted living. 2 of them decided that they just didn't like the food. And 1, well, maybe 3 went to assisted living.
Okay,
I can't remember what the other one was. I'm sorry.
that's okay. No, it gives a sense.
Yeah.
Right,
What are the COVID precautions are in place?
Just that when the volunteers go to the door, they wear masks, they typically don't go inside the house unless one of the clients asks them to come inside. One of our women, she's in a raised ranch, so she's up on the second floor. It's hard for her to get down to the door, so we do go inside and place the kitchen counter for them. That we do there, and we go inside, but we only go inside if the client requests us to.
Okay, and environmental health.
So I'll do the environmental health update. Tara is off today. We are actively searching. We've had 2 rounds of interviews for a full-time environmental health agent. I believe we have some strong candidates, so we hope that they will be an offer made soon and a person in place hopefully by mid-April. That would be great to have. Unlike some of our other positions, we actually got a very strong pool of candidates for the environmental health agent role, including a number of really qualified people from out of state. And from other parts of this state. So that was a pleasant surprise because lately it's been very challenging to get big and qualified applicants. There's also a very diverse applicant. We'll go into it, I think, in a little bit more detail in just a minute. You can see the follow-up from the tobacco compliance. Tara's worked already to get that scheduled. Done some policy work. There is still a number of housing issues, one of which is still very time consuming. We've been working with the building department and police on that issue repeatedly. You can see the food plan reviews and follow-ups. Most of those are pretty routine following minor disruptions. North Hill is a major kitchen layout and change. Some small nuisance updates. We did get planning board feedback. We're working on funding, and this year we're sort of taking it say it's part of a pilot program, but other communities have had a lot of trouble with outdoor dining when pest control has been left up to the individual restaurants. Some people are conscientious about that and some people are not, and when there are people who are not, that leads to pests. So we are taking on the cost this year as an expansion of the pest control work we do at all public parking lots. We're taking it on for those, I think, 5 or 6 businesses that are going to have outdoor dining. The thought is we have some flexibility with our funding this year, that we would then incorporate that cost. Either the cost would be incorporated into the fee that's set for establishments if they want to do outdoor dining for future years, or we would set the parameters and say, you need to show us a contract showing this level of service from this company, and you need to, once a month, send us all your reports, the pest inspection reports. So we're still trying to figure out which one is preferable, whether we set the standard and they have to show documentation that they're meeting it, or whether we pay for it because they build in money to pay us for it. What we have found from other communities is that letting them pay for it on their own and letting them decide leads to very different levels of cleanliness and reads very different levels of rats. So I think that's fairly positive. The issue, unless there's questions about the general report, I might go into the Rice Barn food permit discussion.
Yep.
So it has not yet been, but it is coming up on a year since the Rice Barns food permit was suspended by the Board of Health. The owner has indicated an interest in reopening. There was originally some talk of him selling. I think the landlord had wanted him to sell, but the restaurant owner intends to try to reopen a restaurant. Tara and the building department, multiple representatives from the building department went over with the landlord and with Mr. Intra, the owner of Rice Barn. They found a lot of things that concern them, including a lot of trash in Harvard areas, still some food, still significant evidence of pests. One of our real big concerns was that the evidence of pests, the restaurant owner told us he had pest service in place, we followed up and the pest service company said, you know, no, we were in place for, you know, hot minute and then he paid us and he hasn't had us come back since. That's a concern. Another concern is that he moved a lot of the harborage and junk and trash in the basement over next door to the basement of the toy store, which if that's where a number of the rodents are hiding and living, doesn't really solve the problem of rats in the restaurant because they just go back and forth between the two stores in the basement. So we have significant concerns still about his ability to operate a restaurant. There is also, you know, and whether it was a policy decision of his or a financial decision, the fact that he didn't keep up his pest service when there is still clear evidence of pests on a weekly basis is problematic to say the least. Tara and I did talk to town council and got more clarification about the parameters, and not surprisingly, the board has pretty wide discretion on setting sort of the level of confidence it needs to have in a restaurant owner to open and what is required to demonstrate that confidence. So this will continue to develop, especially if Mr. Inta continues in his desire to reopen as a restaurant, but unless there's some fairly dramatic improvements, the public health division staff will not be recommending to the board to approve the permit anytime soon.
I had a question. Wasn't there a rumor at one point, at least, that he was operating a ghost kitchen out of that?
There wasn't a rumor, there was documentation that he was.
Okay. There's grease on the floor and there were food remnants in the wok strainer.
Yep.
Is he still cooking for something in there?
We don't believe so, although we're not positive. We have gone by periodically and, you know, if he was operating a takeout or DoorDash delivery type function, we haven't seen it. That's not a guarantee that's not happening, but if it is, it's at a fairly low volume such that the times we've gone by after hours we haven't seen anybody going and going. I think for us, I mean, it would almost be better in my mind if that's what they were doing, because otherwise he's just been leaving stuff out for months and months and is surprised that he has rats and other pests.
Yeah, because you said there was food there. I mean,
Yes.
it's been closed for almost a year, so when is that food from? But I had a question about it sounded like there was a lot of other electrical and other things that are not up to code. And is that the responsibility of the landlord versus him, or how does that work? But that seemed like a lot of issues as well.
I think that is a lot of issues. It is not the responsibility of the landlord if Mr. Inca is the leaseholder and wants to open a restaurant. If there is no leaseholder and the landlord can rent the building sort of in whatever shape he wants. It's the responsibility of the occupant to bring it up to code, unless the landlord decides to bring it up to code and then to charge more. But I think there's been some serious electrical work that will need to be done. And at least our building department believes that's the responsibility of the restaurant owner, and so does the landlord. There was a pair of women who were looking to open a restaurant. I don't know if they've moved on, but they had expressed their interest to the landlord. Mr. Inta indicated he wasn't willing to give up his lease. So we'll see how it plays out, but it is still an area of concern. There's still feces from rodents. There's still, you know, leftover food that should have been cleared out a long time ago that we've told them about multiple times. There's still rubbish and trash, for lack of a better word, and just junk in the basements. So.
Can I just make sure we're certain that we're looking at the same things each time? I want to make sure we're not moving the bar on this person, right? Like that was what we were accused of before. So anything we saw here that we documented is something we would have done 2 years ago in an inspection. I just.
Yeah, I mean, the feces usually aren't in the same place each time, but.
Yeah.
But,
yeah, okay.
I think,
Well, like the
Maybe.
electrical inspection, all that, that's sort of a new thing of reopening. There's a whole process around reopening, correct? to
There
do that?
is, so there is a little bit of momentum when you have a restaurant going, you don't have to go through the full process, but we are. If he wishes to reopen, it's not a just restart your permit from where you were. It's a policy that applies to everyone, but if there's a substantial remodel, if there's substantial damage that requires renovation, or if it is shut down for any significant length of time, you have to basically start over again with a full review, and that is what is being caught now. We'll keep you updated on this, but we don't have confidence in the ability of the current owner to operate a safe and healthy food establishment at this time.
Okay, we'll wait for future updates. All right, so Diana, back to you on capacity assessment resource toolkit.
Possible, I'd like the record to reflect that we are exactly on time right now.
That is
Quite
not
an
by
accomplishment.
accident. No, I'm just kidding.
Hopefully I'll stay on time. So my presentation is going to be a little bit on the quicker side, just so we have enough time to discuss and if anyone has any questions. But we'll jump right into it. So the capacity assessment results toolkit. You can go to the next slide. Basically this toolkit, like I said earlier in my update, use all the data that was collected in our capacity assessment that was done by the state. It was developed to assist shared services arrangement in utilizing the data from the capacity assessment to inform the development of their work plans. So to develop the work plans, our shared services arrangement may use the recommendations or develop alternative approaches based on the data found in the summary results and recommendation sections of the CART and Tableau data dashboard. Next slide. So basically the timeline is we've completed the capacity assessment. And like I said earlier, it was just completed by Needham, Dover, and Medfield. Sherburne is not included because they were not a part of our public health excellence group at the time that the capacity assessment was being conducted. Back at the end of February, we had a data review meeting with BME Strategies and the Office of Local and Regional Health. I encouraged the Board of Health members to go through the whole packet that's included here to review the data that was collected because we are able to submit any corrections so that we can make sure that the data is accurate and our results are reflected correctly. So this toolkit is going to be the basis to determine our funding for the next fiscal year. So the state is still developing a mechanism to figure out how they will allocate that additional funding, but existing funding will not change. The only way that it can change is by increasing. So right now we have $150,000 every year in that public health excellence grant that is guaranteed at this point. Now that we have Sherburne joining on and using this capacity assessment, there is potential for us to get more funding. But like I said, the mechanism is still being developed. We have to create our work plan and budget by the end of April. So that is my next big task to be working on. But before or continuing on, we'll just dive into some highlights of the capacity assessment. So the first slide here, trying to make it bigger on my end. This is the capacity assessment responses by subject areas. So overall, our region, we met about 84% of the standards that we're supposed to be meeting. So as a region, technically that's like a B+, doing decent. There's still room for improvement. As you guys can see, some of the areas that we need a little bit more improvement are in environmental protection and tobacco use prevention. So in this table, this is showing where we meet the standards, where we need improvement. Like I said before, this isn't individually, like this isn't just all the reports for Needham. This is Needham, Dover, and Medfield all combined. They did not want to focus specifically on one town. We can move to the next slide. So this slide shows us reasons why we might not necessarily be meeting standards by subject area. So the different colors, so as you can see, like we don't lack funding, but what we're seeing is that there's some standards that we may have been unaware of. There's some, like in community sanitation, I see the darker blue means we need a little bit more training in the region. And then the gray indicates we just need more staffing. So the working group, we're going to take this data and hopefully come up with a way that we can make these gray areas and light blue, all these areas we want to improve. We want these numbers to go down. We want to improve. So we can go to the next slide. This gives us an overview of the current staffing in the region. So I thought it was good to include it here just so that we had an idea of what we have. Like we only have Julie as our epidemiologist in Needham. We only have one epidemiologist in the whole region. So it might be helpful to think about like if that's a resource that we need, maybe we can provide funding to increase that for next year. Public health nursing, as Tim had mentioned before, the capacity is still being built up in the other towns. Needham has a pretty strong, as we know, a pretty strong public health nursing program, but we want to look to increase that in the other regions as needed. But I thought this was good so that we can see what we have currently. And then the next slide is next steps. So like I've been repeatedly saying throughout today's meeting, we want to use this data in our working group to inform our intermunicipality agreement. We need to submit corrections as needed. So now that you guys have access to the complete toolkit, once you review it within the next week or so, if you find something that you have questions on or something that sticks out in your mind that needs to be corrected, please let me know so I can submit back to the state and to BME so that we can fix the data as necessary. And then final step is to create and finalize a work plan for FY24. So these
Great,
next
thank
slides,
you.
this is going into the full packet.
Questions? I think it'll be really interesting for us to see that work plan, but this is great data to build off of.
Yeah, I mean, I think I wish we had been able to tease out a little bit more of what each community's response is, because I guess putting myself in the shoes of someone from Dover or Medfield or Sherburne in their administration, it looks like we're getting it to general speed. However, that's Needham pulling up a lot of their averages. I mean, you can sort of tell tobacco prevention, right? We have a very strong tobacco prevention program. Clearly, the other communities do not, because it, averages out to a 70 or a 60, whatever it is. I worry that sort of seeing a gentleman's B, the message is, well, things are pretty good. And I think the answer is, if we develop a regional capacity and really share everything, then maybe things are pretty good. But right now, your individual communities do not get a B. I told the board, I think it's a fairly simple sort of equation, and I think one of the best examples, and Diana's talked about this, is Dover gets complicated septic plans multiple times a week. We get a complicated septic plan 6 times a year, every other month, every quarter, maybe.
Yeah,
Dover has
something
a
like,
food-
yep. I feel like
Sorry.
if you can swap the numbers. Needham has 140 food establishment, Dover has 6. Dover gets 140 septic plans, Needham gets 6. So there's different needs in the community. So that's why we have to figure out like how we can best serve each other, because it's not exactly the same. So like, even though I worked in Needham as an environmental health agent for 4 years, I don't necessarily have that septic expertise because I was only being exposed to 4 or 5 a year. Whereas in Dover, their previous septic agent was doing that constantly throughout the year.
That seems like a really great example and hopefully fairly intuitive of, hey, Dover, we could pick up your food establishment inspections and we can knock them out in a weekend, not a big deal. If you helped us with septic, we don't have to have that expertise in-house, or certainly you could be our backup or something. I think and hope that that argument makes sense. It gets more complicated when you're talking about, you have a staff member or a contractor and they're in an area where someone else has a strength, so you really need to reassign that funding for that position or that contract to do something else in public health. There's not an option to take money away. If you're getting grant money or grant resources, you need to supplement what you have, not supplant.
I think, you know, what you say makes a lot of sense. What we're seeing is the combined data for all the 4 municipalities. But I'm assuming that it exists by municipality somewhere on a chart. And I think it would be good if everybody could look at that, you know, and it doesn't have to be done in a pejorative way. It's just, this is the way it is, because this is the way it worked out, but how can we make it better?
Absolutely. So Diana, you can correct me if I'm wrong. I believe each community can sort of request their own data.
Yes, I was just about to say that. So they are uploading all the data that was collected onto Tableau. So Tableau is a data assessment program, but we would be able to pick out individual points, I believe, in that, like, we have access to everything that was collected, but I believe it would be kind of, we would have to parse it out a little bit on our own, but they are holding Tableau dashboard trainings so that we will be able to parse out that data.
One of the big concerns was politically, you know, it's challenging potentially for a health director or a board of health with their select board or town administrator if you know, their grade is an F and everyone knows their grade is an F. Regardless of the reasons that went into that, lack of funding, lack of institutional support. So the state was very sensitive to not have sort of data that's available that could say, you know, you got an F.
Right.
But I do think people hopefully have some understanding of the capacity of their community. And if they see that, like tobacco, like, wow, we've got a failing grade as a region on tobacco, but I know that Needham has spent years doing this as a leader and puts a ton of resources into it. It must be because we don't do it at all. I'm hoping that people come sort of with that level of honesty or that level of self-check that they've already done.
I mean, if the goal is improvement, that's the mindset you need to have. I wonder if, I mean, we know our data. I wonder if there's a version you could start with, at least that's sort of Needham. You took out the Needham component, you know, how, and so don't necessarily split out the other towns individually, because maybe, you know, that'll raise some sensitivities, but you could do just subtract Needham out, because that'll show some pretty big differences, I think, if we took that out.
Yeah.
So then we know our data, so we could control that component.
I guess I don't get the secrecy. It's, I don't know.
I know, like, this is about improving. It seems
And
like
it's public-
transparency is.
I mean, the public agency, it seems like it's really public information.
The state, and
Sorry.
this is actually in response to Mass Association of Health Boards, but the state specifically did not hold the data, so none of it is deployable. They had a contractor completely hold the data, none of it is on state servers, none of it's in state email. I find that a little bit disturbing is the right word, but it was at the request of the Mass Association of Health Boards because they were worried about embarrassing some members. So.
Well, part of it too, I mean, we've done this in healthcare where we compare data about like how all hospitals are doing on outcomes, and a lot of it is about building trust within your work group. I mean, that's a big component, because then it will lead to more transparency about, well, we have gaps here and we need help and all that stuff. So, but I do think subtracting out the Needham component, because I think Needham probably is the biggest set of resources to sort of highlight Needham versus everyone else could be powerful.
Absolutely.
And seeing gaps could help some of these towns get resources from their towns.
Right, because if they just show the
So-
B, then the towns can be like, oh, we're fine,
Right,
which is
yeah.
not the story at
taken
all,
care of.
which is
So,
not, and
yeah.
it's not set up that way, so, yeah. Okay. Anything else? Any other questions?
I mean, I think, one of the things I find interesting is that's page 95 of the PDF. Or 94 or 95 of the PDF is the funding per capita. So we can look at that and we know what municipality A is, right? Because municipality A has a lot of grant funding. Right, that works out to be 700,000, 650,000 in grant funding, so we know that that is needed. We do know that per capita, municipality B, and I wonder about this number, but does actually spend more per capita. And I imagine that that must be Dover, because they have such a small number of people that if they spend $100,000, $150,000, that's a decent amount per capita. It does show you that one of the challenges is if you do have a very small community, it's hard to, like there's a critical mass you need to invest, not just a per capita amount. And adding Sherburne is helpful, I think, but Sherburne is the smallest of the 4 communities. More people and more horses than people. But horses are a public health issue sometimes.
Is there a place to drill into what like these components, like, of course, I'm interested in environmental, like if I want to see what those 19 factors are. Right, or is it just this summary information?
Diana,
Can you repeat it? I didn't hear it all the way.
Like drilling into the elements of the particular, like, environmental or tobacco, like what are the components for that? Like N equals 19, like page 78 of the bar chart, like what makes up those 19 factors under environmental protection?
My understanding is that 19 was like the number of reports that they had asked from us. From all the towns. And what was submitted, because I have access, I can share. Because I have the document requests that were submitted for each town. I can share that information with everyone if they're interested.
I think it's the standards, right? There's 19 standards under environmental protection. You decided whether you met them or not.
yes, and we had to
Okay.
provide upload documentation, so they would say, you said you inspected restaurants, show us 4 years of inspections from these 4 establishments.
Okay.
So, but I think that is helpful to understand, and I would love to drill down and, did we upload something wrong? Did we, scan the back side of the piece of paper instead of the front side of the piece of paper? I don't think so, but yeah, it would be interesting to see. And we do want to go through and sort of make sure that we have accurate information, because we do have some time to correct it if there is a mistake.
Okay, well, I'm sure we will hear about the work plan as it gets put together. Why don't we move on to our alcohol compliance and select board discussion that we had, because I'm curious to hear how that went.
Carol wanted to mention something about Medfield data, if you don't mind.
Oh, sure.
Hi. Thank you. Thank you. You all know I've been on my Board of Health for many years, and we all appreciated profoundly, without words, Tim taking this on, and Tiffany, and working to support us in Medfield. I just have to say that I agree with Tejal, and you all also know that this is primarily about relationship building and trust. Putting the data together is really, as Tim said, gives a very inaccurate picture to have one grade. Back when the workforce survey was our board members' responsibility, we asked our one paid full-time staff person, which is our new public health nurse, and the part-time admin, to share our data with Diana, all the feedback, so that our town of Medfield could be looked at individually. We see this as a gift and a capacity building project that we will never be able to replicate due to the fact we don't have a commercial tax base. So FYI, our board did say we would like our data shared and split out. And we have seen that this is more of building a trust for our town administrator and the consultant we have to let Diana and her team come in and enhance the services we have. So I just want to say that from Medfield, I can't speak from Dover's standpoint or Sherburne. We appreciate that. A lot of these feelings were shared in the Regina Villa interviews that most of you participated in. I feel like that feedback could be shared as well in this working group. And the last thing I'll say is that we in Medfield have a drug-free communities grant. So the program director put tobacco compliance checks in her budget. That's one thing that Medfield does have for tobacco. But on the other hand, we have a contracted environmental health agent that works with other communities. And she, in fact, is the chair of the Franklin Board of Health and participates in a shared services agreement. So I appreciate that she will sit on this working group for us, because I feel that bringing in the established service provider who's contracted and her communicating that to our town leaders will hopefully enhance the uptake of this whole program, because our towns overlap. And what Tim is trying to do with this money and Diana will be helpful for all of us. But right now we see our board as more of an issue of building relationships and trust in this program, which our board members believe and trust in, but we're working to have the town leaders believe in it too.
Great, thank you for sharing that.
Yeah, I just wanted to say one thing. I'm seeing this work out in real time, but this idea for this was generated by the statewide commission on local and regional health, and it seems to be working out exactly pretty closely to how we envisioned it as we were talking at our meetings. So I'm really quite happy to see that this is working out.
Great. Okay,
I apparently forgot to include the accreditation report, and I apologize for that to Lynn and Cindy. Cindy, would you be able to give a brief update?
Sure, happy to
I
do.
don't know how I missed it, but I did.
Do a 1 minute update. We've been working with Julie a lot on the community health assessment, working with Caleb on the documentation for the domain related to emergency preparedness. Lynn's been working on quite a few policies, updating, revising, sharing with the groups that are most responsible for implementing them. And we've also been engaged in trainings both through the state and through the Public Health Accreditation Board. So kind of just keep plugging away. Thank you.
thank you. Okay. Now, select board and alcohol, yes?
So what I heard from Karen and other folks was that Stephen and Kathleen did a great job for public comment. I think it's always tough to tell sort of how the select board is going to take public comment, because they usually aren't like, that's a great idea and we will incorporate this, or that's a terrible idea and we'll ignore it. They generally try to keep their feedback to questions or but I think we certainly made clear the board's position. I appreciate that it was a very rushed sort of time frame between the discussion on Monday evening, turning around a letter, presenting, less than 24 hours later in a public hearing. But I appreciate the work that Karen and Carol and Lydia put into getting the letter together, and for the board to have that discussion, and then to be able, some members to be able to go and present was great.
Yeah, I guess, the only two members of the select board commented at the meeting. So Matt Borelli seemed to express some support for the idea of in-person training prior to a server who had produced a violation returning to be able to serve again. So I thought that was encouraging. He was not in favor of, of keeping the hours where they were. And I think Mary Ann Cooley, if I recall her comments, and I'm sure you could see them on video, obviously, started out by saying, well, I think we should have a different conversation, which did not exactly sound encouraging. I mean, you kind of heard that more from the context of, seeing the whole presentation. So I'm not sure what you thought of that.
Yeah, I was a little confused. It seemed like she thought that this was cleaning up regs that were thrown together quickly previously or something. It didn't sound like like the penalty part wasn't well thought out, I think, or it wasn't a big part of the review of the regulations. I didn't think it was a cool reception. I thought it was, that they appreciated it. I don't know. I guess maybe I see the glasses half full and people are smiling and nodding. I think making the public health case, this BU report is really helpful, I think, because there's actually, and it's not just they put together a paper. I mean, it's based on some good research. I pulled those papers the other day. So, I don't know what it will mean. I mean, we talked about access outlet, outlets and hours. And then one of the retailers spoke afterwards supporting our statements, saying, I don't need my liquor store open past 8 o'clock. As he said, nothing good ever happens after 8 o'clock. And what Needham's like after 9. I mean,
I think the phrase is nothing good ever happens after 2 a.m.
Yeah, right, midnight or the old work up the early gets, so, yeah, but, so I do think they see, and the numbers speak for themselves. I do think us sort of coming in right at the last minute, that's really, we knew about these regs earlier. I don't know how we can improve that process, whether 2 of us are allowed to dig in and come up with something earlier and then meet on it, and how does everybody feel about these things? It was a little bit, and that was, it was a little unfair to them.
So I think that's a good point. I originally tried to get the board together and a doodle, and there was never more than 3 people, and often there were only 2 people who could meet. And then my family got a stomach bug and I was sort of knocked out. So then the staff picked up rescheduling. I do think that having 2 board members work together on something is something that the planning board does and something the select board does. And we historically have not used that as sort of an option. But I mean, we have a smart and talented board who's very professionally qualified, and it would be helpful, I think. So maybe we should think about that in the future is, 2 of the board members get together, talk about it and put an outline, and then we send it to the rest of the board and see how they feel, and then try to have that meeting.
Yeah, I think that's good to try to expedite. I mean, but in fairness, I don't think we got even these edits from the select board till relatively late, right? I mean, it wasn't.
They announced it on the 28th and they sent it to us on the 5th. I'm not sure.
On March 5th. Yeah, they turned this around pretty rapidly.
Yeah, I mean, we didn't have it for that long.
Right.
But I do think your idea about maybe having people work on some significant project like this. Together is a good one. We're still getting used to the idea of having 5 members. When we were 3 members, you couldn't even get 2 people together without having a public meeting.
Yes.
And so that kind of discouraged any of that kind of thing. But now we can have two people together and we don't have a public meeting.
Yeah.
So
Yeah.
I think we could do this.
Yeah, absolutely.
The other thing is, I don't know if there are any public forums like League of Women Voters regarding the ballot question
Hmm.
and whether or not we want to present in such a forum.
Does the League of Women Voters sometimes do
They
those?
often do. I haven't seen anything for this town election about the ballot question. I think there's one or two contested races that I thought were gonna have a forum for. They may have already had it.
They are.
Oh, it's on the
27.
27th,
Yeah.
yes.
Okay.
Yeah. Mhm.
But is it around the ballot question as well, or?
It's, I think it's everything will be on the ballot. And my understood from what I remember is if it's a contested seat, then they'll have two or three, however many people are running for the seat. Get up and make a presentation, answer questions, etc. If it's not contested, it's more like a hi, how are you? Here I am. Yeah, got any questions?
Yeah,
Ask me something.
and they take questions from the audience, and I had
Yeah.
to do that a few years ago. But I don't think they were talking about. They just got the phone, though.
Well, do we want to ask them about providing a presentation on, the information we have on alcohol
At that event.
at that event? Yeah.
So, yeah, on March 20th, there's a focus on the 2023 ballot questions. On the Needham channel and on Zoom, it features Marianne Cooley and Police Chief John Schittler. But it's going to be about the ballot questions. One is about the related to the police department, and the other is related to the alcohol stuff. So it seems like an opportunity to just share.
What time is it?
This is
4:30 p.m.
March 20 at 4:30
And where are you seeing that, Tejan?
on the League of Women Voters site. I can
Yeah.
send this link to you, Tim, but that's what, Monday is coming up.
Monday.
Yeah, I'm working 3 to 11.
Yeah, I can't. I'm. gonna be
And
out of the country.
I'm in Dallas on Monday, so I can't.
I can't do it.
Oh.
Um,
Well, Rob's not here. We could just, you get us.
I know you gotta like it.
Madam Chair, so
Yes,
I don't know if any of the members, we could certainly submit a question to League of Women Voters to ask if they could ask it, or.
could we share our letter that we,
Sure.
just
That's an idea.
share a letter with League of Women Voters and ask if they
Well,
could
the-
share that, or I don't know.
The thing is, the letter isn't really. on
Yeah, that's
point
true. It's very
to
detail oriented
the- Right, it's not
Yeah.
on point to the
for the
ballot question.
sales issue.
What would be on point to the ballot question is sharing data regarding, the Metro West survey that we have a problem in Needham. It's the first thing. And data that increased access to alcohol leads to increased drinking and increased injury. And then, do we want to make a statement as a board that, the Board of Health does not support this, because of these factors? Right, and then you can bring in we could even bring in the compliance checks, right? And because then we say, we have increased access leads to increased injury. We have, already we have a problem. We've seen that, currently the town is not doing a good job in terms of, compliance with underage drinking. And given that, we cannot support increased access to alcohol in the town at this time. And that's the end of the statement, and it's very factual,
Mhm.
right? So, it's not saying that, we're, I guess it's saying we're against this, but we've got a really good reason why we're against this.
And we are allowed to take a stance on these kinds of, I know you as a town
Public health
employee.
division
can't.
professional staff can educate and inform the community about the public health impact of all these, but we can't say vote no, vote yes.
Right,
The Board of Health are independent elected politicians, and you can feel free to engage in whatever elective activity you want.
okay.
So I think that we as a board could do that.
We could, or we just, you know, or I mean, here the facts speak for themselves. I mean, if we even didn't
They
want to
do.
say that, I mean, it's like, you know, we just wanted to let you know, here are the facts
Here are the
about how
facts.
we're doing so far with the current access that we have to alcohol in this town. Guess what? We've got a binge drinking problem. We've got, you know, no compliance and, you know, and the data shows that increased access leads to worsening outcomes.
And I
You
think if we
decide what you
say,
want to do.
I mean, if we say we are not in support, I think, you know,
Mhm.
that's a message for sure.
Yeah.
The
And I
question
think
is,
we
how do we communicate this during this? I mean, I don't know how many people go to this, this Zoom, but
It's people who vote.
Yeah.
yeah.
I mean, I don't know. on
Yeah.
Zoom,
The
but-
turnout in town elections is not particularly high.
Yeah.
Yeah,
But I think we ask the league, basically for time. It's like, listen, you have a proponent, but you don't have anybody who is speaking in opposition to this. You know, if you want to have a balanced presentation, you know, we would like to be able to present the letter. You know, I mean, we don't know that we're going to be able to have somebody physically there, you know, and we understand that you have limitations in time and all of that, but we would like to make a statement, you know, at that meeting.
which, you know, I know it's a tight turnaround, Tim, but we could probably put those bullet points together pretty quick. I also don't know if there's somebody that from, like, whether you could just read the points and representing the board, since we all seem to have conflicts. I don't know what Rob's schedule is. Just to say, I'm here representing the board and here are the points they wanted to make. I don't know if you're available at that time, but
Wait, Monday at 4:30? No, I can't. I'm here
We're
at
not
the,
allowed to do that, right?
I don't know if I'm allowed to do that, but I'm also here at the capacity assessment meeting with multiple people,
mm,
which actually Ed is where you're supposed to be too.
Yes, I know.
I will try to text Rob and see if he's available, but I do like potentially the idea of asking the League of Women Voters to say you didn't allow time for some opponents of this, the Board of Health is not in favor of this at this time. Here is, you know, a one pager
Mhm.
outlining why, if you don't mind mentioning it, and we'll print copies for you.
All right.
Yep.
Could I make?
give them a slide too, maybe. Because if it's Zoom, they could put the slide up of, you know, Board of Health stance.
Could one of us make a motion then that, we submit a one-page document or a document to the League of Women Voters for their meeting on Monday night, listing our concerns and explaining why we're opposed to the change in the liquor
Yeah,
regulations.
I mean, I wouldn't limit it to one page, but otherwise,
Oh.
yes.
Yep.
Well, because I mean, you know, we could actually have a couple of slides. I think to Joe's point is a good one. You know, you put up some of those, you know, you put up a graph showing compliance, you know, success and failure. Just the amount of the sea of red on that grid speaks volumes.
Mhm.
And I think that that's one of the most powerful tools we have is visual. You throw that up, you know, here's how we're doing our compliance checks. Pass is, you know, green, red is fail. And, you know, here are the dates, here are the number of vendors. Let the numbers speak for themselves.
And I do think the League of Women Voters, if there's something that's related to health, like it would be appropriate for them to be reaching out to us on some of these events, but that's a whole nother story. But yeah, I mean, do we need an actual vote on that, or can we just do it?
But I think a vote would be helpful. So this would probably be, and we were going to talk about later accessory dwelling units. But this would be like a Board of Health policy position or a Board of Health statement or something like that. However we phrase it, but basically weighing in with the board's concerns about increasing alcohol availability, the reasons behind that related to youth use, binge drinking, alcohol compliance failures.
Yep.
Okay, yeah.
All right, so then, as Ed just said,
Okay, then I can turn that into a motion.
okay,
And I'll second the motion.
Okay.
all in favor?
Aye.
Great. Madam Chair, the next item on the agenda is the public hearing.
Yes.
About biosafety labs. We did not close the hearing last time. We continued it over to this meeting.
Yep.
We did receive one public comment, which was in your packet, although it wasn't fully incorporated. Julie did incorporate multiple previous comments and suggestions. into the revised draft that you have that's starting on page 131 of the packet. And just, yes, let the record show, Dr. Brown stepped off as she had indicated previously that there was a potential conflict of interest because of the work of her company, so she is recusing herself from the discussions and the vote.
Okay, so there, you said there was one addition, there are some additional comments that did not get
So there's
incorporated?
one person online who has their hand up who I believe would like to make a public comment.
Okay.
And then I believe you're back, sorry. Yeah, so
Welcome.
Betsy's back. If it's okay, we'll take the person who's been online just because they,
Yes.
okay, so I will. Barry, you're here to make a public comment about the biosafety regulations?
Yes, good morning, everybody. Can you hear me okay?
Good morning,
Yes,
yes.
morning. Who is this?
Thank you.
Barry Pollock.
Oh.
Barry, do you mind just to, because it's a public hearing, usually say your name and your street address, if you don't mind?
Sure. Barry Pollock, 15 Pandolph Lane. I'm a town meeting member from Precinct J, and probably irrelevant to this particular discussion, but I'm also an elected member of the Board of Assessors as a matter of disclosure.
Thank you. Go ahead.
So if I understand correctly, the existing biohazard regulations are primarily registration oriented. It would allow there to be information, but there is presently being considered the increase of regulatory or licensing efforts when we're going to have biohazards in town, perhaps in the form of laboratories or otherwise. And I have three suggestions. I think it breaks down into three. And as a matter of background, I'm a former federal prosecutor. I served in that capacity during the emergence of a long time ago, during the emergence of corporate compliance programs. And I served, I think I ended up being the longest tenured board member of the Massachusetts Society of the Prevention of Cruelty to Children after I was a federal prosecutor and actually developed its compliance program, where its work was primarily contract work or largely contract work with DCF, and there were billing issues to be concerned about. And I bring that up because my first suggestion to the board is to require that registrants who receive approval to engage in at least certain types of the more complex biohazard work represent that they have an effective compliance program. And as some or all of you would probably know, there are 7 elements to what's considered an effective compliance program, some of which are considered more important than others, such as an effective line of communication. But one of the things we learned in law enforcement generally, and I think the Department of Health and Human Services in the Office of Inspector General has put out, is the importance of a compliance program to detect and prevent wrongdoing. And it's crucial, I think, in the work of public health. I guess I could also disclose I'm somewhere between a third and halfway through a Masters of Public Health program with the University of Michigan. So I know enough to respect what you do, and maybe just enough to be dangerous as well. But the OIG from the Department of Health and Human Services puts out 7 elements. And these 7 elements are routinely addressed by folks, and most big laboratory users would already have these in place. But I think if we're going to start drawing in startups in town using space, we want to make sure they've come this far along. And just to put it on the record, the 7 elements are implementing written policies and procedures for standards of conduct and ethics. 2, designating a compliance officer and compliance committee. 3, conducting effective training and education, including compliance training. 4, developing effective lines of communication, usually looked at as a hotline with a promise not to retaliate against employees who would report wrongdoing. 5, conducting internal monitoring and auditing. 6, enforcing standards through well-publicized disciplinary guidelines. And 7, responding promptly to detected problems and undertaking corrective action. Whatever regulatory regime is put in place, ensuring that any significant users of a right to engage in biohazard activities in our town have a compliance program such as this. And it could cite to the Department of Health and Human Services standards could only help detect and prevent those types of mistakes or wrongdoing that, you can't unring the bell on. That's my first and probably biggest comment. My second is that some of the work being done, I think the work of public health is growing. So is some of our zoning. And in looking at our zoning regulations, the Board of Health is mentioned twice. Once with regard to a need to consult with the Board of Health in the aquifer region, and second, what in the floodplain, I should say district, not region, in the use regulations for the aquifer district and the floodplain district. And it would seem to me, if one looks at, so for instance, Highway Commercial 1, I believe its former regulations actually had the usual toxic and hazardous substance prohibition, which was removed, and a new permissive with a special permit use was added for laboratories, including chemical laboratories. I don't know, obviously, the extent to which the Board of Health was consulted about the removal of a hazardous substance, or even just the lack of inclusion of any sort of hazardous substance. So I have a couple of concerns with that. I know that the special permit process through the planning board gave the planning board some discretion as to whether or not to allow level 2, level 3, or level 4 labs, but there was nothing in the zoning that required Board of Health participation, though I understand the Board of Health's identity and participation may have come up in the process of that special permit. I just don't know if it was required. And the zoning change that occurred there, the Highway Commercial 1 zoning, gives I'll call it the WGBH property, not the Muzzy part of it, but the other part of the Highway Commercial 1, some as of right uses that would not be subject right now to the usual toxic and hazardous hazardous substance prohibition. So I'm not altogether sure, without a Board of Health role under the zoning regulations, what WGBH or a successor could do as of right, say if it's not seeking greater density where it needs to go out to the planning board for a special permit. And I'd want to make sure these regulations capture that, and perhaps even encourage collaboration between the Board of Health. I'm sorry? I didn't know if someone said something.
No, I was just talking to myself.
Go ahead. Keep
Okay.
going.
Sorry, so I would encourage collaboration between the Board of Health and the planning board, even in an education process, so that when bylaws are proposed, I know there's a topic today, I guess, on ADUs, that there is something more concrete to ensure that nothing could substantially change and risk the health of Needham residents without the Board of Health's involvement as a safeguard. Lastly, my ask there is just for some proactive collaboration and ensure awareness that the WGBH property may have some rights that wouldn't even go through the special permit process of the planning board if they're not looking for greater density, but want to go out to higher level laboratories. And I'd hope that the regulations as drafted would ensure that wouldn't affect the Board of Health's ability to monitor and regulate any activity that happens there. Finally, I think having just observed the discussion on alcohol issues, I commend the Board of Health on a proactive role as a town meeting member. I'd like our town officials, particularly the ones who are protecting our safety and could end up being, with what we've seen the past few years, maybe the most important issues that we all face as a society. I encourage continued information, whether in the form of when you do have a vote that would allow you to oppose something, I'd want to know it and be able to talk about it. And you'll find that if you put that information out there, there are many of us who would share it with each other so that we have as few uneducated voters as possible. On the issue of two working together, I would just encourage as much as possible that some of us do attend some of these meetings, so it's good to know that something is happening in case we have input like this. But thank you for your time. And if anyone ends up having any questions about compliance programs and how they could relate and how the Board of Health could review it, I'd be happy to share my experience. And I do hope that, I know that one of the proposals is a committee. I hope that the Board of Health will appoint the committee rather than defer that to the select board or planning board, because I think in a health issue, I'd want to see the Board of Health having the selection process for a committee that will monitor these activities. Thank you.
Thank you for your comments. I believe the committee is through the Board of Health.
It would be appointed by the Board of Health.
Yeah.
And it would be a minimum of 3 people. And would include at least 1 board member, possibly or presumably more than 1 board member.
Okay.
And the board had made an indication that regardless of whether it had to be open meetings and public records, it would treat that biosafety committee as a group that should post its meetings and have public meetings.
Correct. Okay, another comment in person?
Thank you, Betsy Gilman Duane from Environmental Health and Engineering in Newton, Massachusetts. I just wanted to say that I appreciate the revised draft of the regulation, has incorporated many of my comments and suggestions. Much appreciated, and just here to see if there are any questions or concerns about any of my past input.
So I think maybe one thing that you could help specifically with is you submitted, and it made it into the packet, but it didn't make it into the revised regulation yet. A letter on March 14th, specifically about section 11.5.1. Just wanted to sort of maybe make that point again, just so that it has not yet been incorporated.
Sure. So that point is in regards to new construction or renovation. So in many cases, a tenant or tenants has not yet been identified. So it would be very difficult to, have the landlord actually go through the registration process because the agents and the science is not yet known. So the idea is that if there is new construction or renovation and there are no tenants, that the developer or landlord just provide written notification of the construction or the renovation, and it not be the process to actually obtain a registration.
I agree with that, because the registration would be for the tenant, if you don't know who the tenant is.
Exactly.
Could the landlord require the tenant to do that, or not require, but at least make sure that the tenant is aware of this requirement in some way?
Smart landlord would, yes.
One would think, but kind of codifying that in some way, because
Okay.
it could be like, oh, I didn't know I was supposed to. I mean, hopefully not, but
Sure.
Yeah, it's basically the intended construction. I mean, the intended construction and renovation is for lab space.
Exactly.
Then that requires a notification to the board. I would agree with that.
Or if you had a building that was offices and they suddenly, but he's using them anymore and they want to convert it into lab space. Before they would actually start construction and so on, they would notify us that this is what their plan is. But then they'll probably build that out in a very generic way, and you won't do any specific work until you know who your tenant's going to be and what they're going to do and what kind of equipment they're going to use and need to fit into that space. And that's when, once that tenant is selected, that's when we really need to get.
Exactly.
yeah. I did, the suggestion from Barry about requiring kind of a robust compliance program with 7 elements, I thought was a good addition. I'm sure it's in place, as he said, in many of these bigger companies, but I thought that was a good add.
I've recognized every one of those.
Yeah.
If it's in place, that's great, but we should codify it just in case there is a smaller operator that doesn't have that structure.
But we don't need that in the regulation. I don't think, do it.
I think it'd be okay to, I mean, especially, well, as part of the, approval process, or I think we're, making sure that they have a compliance program is something that we should do.
Oh, you could put together a guideline, you will need a compliance program.
Yeah.
See our guidelines, and then here it is.
Yeah.
Yeah, I mean, it can be added to 11.5 part 3, submit the following documentation.
Yeah.
Documentation.
That way it doesn't turn into, a public meeting every time.
Yeah, no,
people
for
change
sure.
a sentence or-
But I think they could submit that plan. Yeah.
Okay, great.
Then we can review that. Suggestion about working with the planning board is kind of an interesting one, only because, we indicated right at the get-go that, we're governing the use of all biological, agents in the town.
Yes.
Okay, so I don't care what CBB has or doesn't have in terms of, variances, waivers, what have you, it still falls under what we've got, because they don't have any variance or waiver under this.
Correct.
Right, so if there was some sort of, right that they had, it's like, not under this one, but under some other regulation.
Right.
About the only one that could come in here and probably want to build a lab and need it. We wouldn't have a whole lot of say if the CDC decided they wanted to build something out here.
Right.
And all of a sudden it's out of our ballpark.
Yes,
You might scream, yeah.
but a nonprofit or a commercial developer. Yes. I think one of the other questions we had for the board was the language, and it was an email from town council Chris Heaton about what can be kept private, or just kept protected from disclosure under public record law. So he got a couple suggestions for myself and Julie, and then he had suggested language for 11.6.1, which you can read, and that's on page 151 of the packet.
I thought that sounded reasonable.
I thought so too, but I just wanted to make sure that that was something the board is comfortable with.
Yeah, I'm comfortable with that. I read that last night, and it seems reasonable to me.
Okay. So to me, there's a number of changes that mostly Julie, but Julie and I have to make. The board could choose to conclude its hearing today. We could make those changes, and we could schedule a vote in April. Or the board could choose to continue its hearing, continue to accept public comments. We'll make these changes, we'll post them so people can read them. And the board could continue its hearing in April and then vote in May, or continue its hearing in April and vote, close the hearing and then decide to vote.
I mean, I would be comfortable with closing the hearing at this point. I think we've gotten some good comments, but if others agree, and then we can just do the vote in April.
Yeah, I don't know that we need to hold it open. I have no problem with holding it open, there's not a rush on this.
The board can also choose to accept comment on, the board can choose to accept any type of email or suggestion from anyone at any time.
Yeah.
It's just we have to guarantee public comment at a public hearing. So you can, if someone sends us a very insightful email tomorrow, even if you're
We can
closed the
still
hearing,
accept it.
we can still accept it.
Yeah.
Sure. With that caveat, I'd be fine closing it then.
Yeah.
Yeah, you have complete discretion. You could read an interesting article in 2 weeks and decide you want to incorporate changes. You can do that.
So let's plan on that.
So,
Okay, so-
Madam Chair, you would close the hearing officially.
All right, let us officially close the public hearing on biosafety regulations.
So we will make the edits and suggestions. We will do that in fairly short order, and we'll send it out to the board to double check ourselves. Then we will post that close to final draft online so that people can see it again. And that would be the subject of a vote scheduled for the April Board of Health meeting.
Sounds good. All right.
Thank you.
Thank you,
you.
Barry, for joining by phone, and thank you, Betsy. Tim, you totally jinxed me on time. Thank you.
Maybe I could just briefly go through a couple things. The opioid, it's okay, I'll start with reverse order. The opioid trust, you can see the text that we submitted for a financial warrant article, as well as a brief spreadsheet I put together. To date, we have 217,000 in funds. We're conservatively going to get at least 140,000 next fiscal year. Right now, the town is thinking about changing slightly its approach and putting the funds into a stabilization account. The legislature still says it intends to change the law that would allow these monies, instead of going into the general fund and then having to be transferred by town meeting, an act of town meeting, to basically be treated sort of like a grant, so that it could go into a separate account that the town can set up. When or if the legislature makes those changes is unknown, but moving the money into a stabilization fund would mean that it wouldn't revert to free cash at the end of the fiscal year. So it would stay reserved for appropriation. I have talked to the board in the past about this term settlements and the areas where money can be spent, including harm reduction, access to treatment, recovery, substance prevention, mental health. We would probably, and the board would be sort of a critical partner, but we would look to convene a stakeholder group and come up with, 15-year spending plan is pretty daunting, but maybe a 5-year spending plan. Maybe we'll do a series of 3 5-year plans over the 15-year period. But that we would try to get significant community input, including obviously input from the Board of Health, on how that money could and should be spent. I have already worked with the Director of Youth and Family Services, the police chief, the fire chief, on any of their immediate needs. And they right now don't have any. They have access to naloxone, they have access to training. We've done community trainings on naloxone. So the plan would be to move it into a stabilization fund, convene sort of a number of stakeholders and come up with a plan for sort of a 5-year strategic and spending plan. So wanted to let you know sort of where that stands. That will be subject to a vote at town meeting to create that stabilization fund. So hopefully that would be approved. The Needham Housing Authority would like to come to the board meeting next month to talk about their preservation and redevelopment initiatives. This is something I think the board is interested in, both in terms of the affordable housing element, but also the, as you've heard from Tara and Diana, and the challenging state of physical repair of the facilities, and the fact that as a result of being way past their useful life, they generate a lot of housing complaints and a lot of challenges, sanitary challenges for residents, specifically mold, basically. Vaccine field, we don't yet have the test results back. We're still waiting a couple more weeks, but we're hopeful that that will be good news. Accessory dwelling units, there is an article, zoning bylaw at town meeting on accessory dwelling units. They are making, and I will try not to sound a little frustrated when I say this, many of the changes that the Public Health Division and the Board of Health suggested to them the time they adopted this, when we did research in 10 communities, and those communities sort of told us, ADUs are great, don't make the same mistakes we do, don't make it too restrictive, don't do this, don't do that. Which the board and the Public Health Division then submitted to the planning board and to town meeting. And the planning board and town meeting did make it fairly restrictive. They're basically looking to ease virtually all of those, make it more available, make it so that people could rent. If you were a senior who had a home and had limited financial means, limited income, you could rent out an accessory dwelling unit. I think the question is whether the board wants to issue a policy position or issue a letter supporting those changes, or supporting ADUs generally, or whether it doesn't wish to do that.
No. All I say is the changes are in line with what the housing committee
Yes.
has discussed and is proposing, pretty much in line. And so I think that these reflect the mood of many of the people in town at this time relative to ADUs. We aren't being overwhelmed. We have ADUs allowed. We haven't been overwhelmed by requests. It's not like there's one on it, every other house has one. But so people aren't as afraid of them as they were.
Yeah, that's
before.
I mean, if you think that a letter is helpful, I would be open to this. I know there's a draft in here, right?
There is a draft, yes, Lynn drafted, and Lynn had done most of the work on ADUs originally.
I would support sending a letter. I think it's important. I also spoke at the planning board in support of that, just saying that our previous policy position was to expand the availability of these. I think the one limitation, and I don't know if the letter said that, is that they're making leases be for in a year, and I suggested at least getting it down to a semester for a college student. It sounds like Wellesley put in 30 days, which it gets around, avoids your Airbnb problem, but allows for some flexibility for short-term rental. So I like That would be my own comment, that they haven't gone far enough. But I think we should do a letter, because Len's waiting too.
I agree.
I did get a note, we had said that we were gonna do all meetings via roll, or all votes via roll call, so. Potentially the board could do a roll call vote on this, maybe do a roll call vote on the alcohol compliance legal limited voters letter, because we did a show of hands, we didn't do roll call.
Okay.
And then do a roll call if someone makes a motion to adjourn, so it might be there are 3 roll calls in a row.
Okay, you want to go back to the,
Or you could do a combined roll call altogether.
all right, let's do this one. So a motion to do this letter related to the accessory dwelling units.
I'll second. That.
I think you have to first,
Oh,
the chair's not
Ask
supposed
for,
to.
asking for a motion, sorry. Asking for a
Okay,
motion.
I'll make a motion for us to submit a letter in support of the ADU.
I'll second.
All right, all in favor, roll call, Stephen,
Yes.
Kathleen,
Yes,
Ed,
Yes.
me, yes.
Thank you.
Okay, and then let's back up. It was the one before
So
for the,
We did have a motion and a second for the letter regarding alcohol compliance of legal women voters. We just need to do it by roll call vote.
okay, so we'll do a roll call on that particular motion. Stephen,
Yes.
Kathleen,
yes,
Ed,
Yes.
me, yes. And then there's one more.
If you want to get out of here, someone has to make a motion to adjourn.
Well,
We did it for the minutes too.
before we do, that, I mean, I suppose this can wait until, April 4th. Do we do this April, after the election of the board reorganization
We
board,
do it before town meeting.
board town meeting? Okay, so we'll do it at our next meeting then.
Yeah, I mean, the board historically reorganizes at its April meeting. And that also, Ed is town meeting member, the board of health chair is ex officio town meeting member, so. Yes, doing it next time would mean we'd have at least 2 members who could go to town meeting if they wanted.
Okay, so then should we do the minutes one as well from the beginning? So back to the minutes at the beginning.
But you could do both of them together if you want to save time.
All right, Anna, do I have a motion to adjourn this meeting?
So moved.
second,
Okay, so we are going to take a roll call for all of those. Stephen,
Yes.
Kathleen,
yes.
Ed,
Yes.
me, yes.
Thank you very much. We got a number of to-dos from this, but it'll be good.
Yeah.
Thank you.
Thank you.